If you were basically okay, yes, or thought you were, yes, you might be misguided.
Well, yes, I would want a 1 day a week fast be of any use at all.
That's not the way to do it. Would 1 day a week fast be of any benefit? Well, in some respects it might be of benefit, but in other respects it wouldn't. Now, I mentioned when I talked about fasting that the adaptations that have to take place. First, your blood sugar level falls. The body uses this process of glycogenolysis, uses glycogen from the liver and muscles to bolster up the glucose. Then it will use protein from the muscles to build up the glucose. And then eventually it will adapt to using fat. But this is only after 2 or 3 days. Now, the problem with the 1 day a week fast, supposing you went from an evening meal to the breakfast on the next day but one, you're going about 36 hours, you really haven't given the body a chance to adapt to the fasting process. So what you're doing 1 day a week, you're forcing the body to go through this hyperglycemic experience, mobilize its glycogen, break down protein, and never actually get to the point where it's going to survive on fat. Now that's a very expensive thing to do, and it's something I would not recommend. If you get any symptoms or you're not feeling so well, or you get a tummy upset by all that means fast for a day, but the fast 1 day a week in and week out, I think is a very bad practice, and I wouldn't recommend it. I think you're looking at 3 days as a minimum time to get into the adaptation and get any real benefit from that. But as I say, if you've got a tummy upset, that will probably go away in 24 hours anyway. Nothing wrong with it. It is not the problem with a 1 day fast. It's the problem with a 1 day fast repeatedly every week that I am concerned about. And I think that's a bad thing to do. Yes, sir.
I fasted for 2 years, once a week.
Mm-hmm.
Almost 2 years.
Yes.
And at the end of that, I found that it was just impossible to do it
Yeah, well, you did a remarkable job there, fasting 1 day a week for 2 years.
Almost.
I think it was not, in my view, the beneficial use of fasting. Anyway, all credit to you if you did it. Yes.
I was listening to a program on radio about sleep apnea.
Yes.
Common sort of thing you hear about now.
Yeah, it's a new diagnosis in recent years, sleep apnea. Yeah.
What can you say about that happening?
Well, I think you will find that the majority of people in our society have upper respiratory tract problems. I should think that fully, well over half of the people I would examine would have a postnasal drip. They'd have some type of catarrh or sinus problems. They'd have a history of sore throats or some middle ear problems. In other words, that people have got a lot of problems around here. We have enormous problems with air pollution, and the upper respiratory tract takes an enormous hammering in our current environment. And I think that sleep apnea is a pathology that's a result of many causes that exist in our current environment. And we've had people in our clinic many times, not for sleep apnea, but who've had sleep apnea, along with other things for which they've been having care, and the sleep apnea has actually disappeared. And I've found that the adoption of a reasonably sensible, rational, hygienic lifestyle will usually deal with this, but not necessarily in a week or two. It will often take several months. But I don't see it as a pathology requiring any special treatment. Yes, the lady.
How could someone who had a cyst could be a breast cyst,
Yes.
get rid of that cyst without surgery?
Well, most breast cysts, I mean, it depends. There are a lot of, polycystic breast disease. There's many cysts that evolve. They come and go depending on the hormone fluctuations in the body and the place in the menstrual cycle and things like that. Now, I would suspect where there's a cystic breast, I would have to look into the hormonal state of the woman at the time. And I'd be interested in looking into that and trying to normalize the hormones.
Is it something the individual could do for him or herself?
Oh, most certainly, yeah. They can you test the hormones at different stages in the menstrual cycle and find out if and where there are irregularities. If everything's normal in that respect, I would say that it's possible that it could be in, say, multiparous woman, a woman who's had a number of children, one or two children, and there could be cystic disease forming as a result of malfunctions in the formation of ducts and things like that. In which case they may need to think more seriously about radical things like fasting or something like that.
What about the juice fasting?
No, it won't do with juice fasting. See, one of the things about juices, I might have commented in my talk about juices, because a lot of people equate juices with fasting, but there's one heck of a difference. I mentioned this sequence of events about the lowering of the blood sugar level. Now, if you're on juices, even on carrot juice, your blood sugar level will not go down low enough for the mechanisms to switch to utilizing the fat. So you can go for 20 days on juices, and the body will still be hooked into glucose. It never gets around to using the fat, because utilization of the fat, for that mechanism to occur, the blood sugar level has to go down below the physiological minimum. And it won't happen on juices.
Strict fasting then?
It's only strict fasting on water.
So there's no natural hygienist doctor down here, so how could you get something like that supervised by a doctor?
Well, we'll have to get one down here, won't we?
Yes.
Yeah, well, that's a very desirable thing. We'll have to work on somebody. But as a matter of fact, we do have somebody going through school at the moment. The Philip Institute, they expect to graduate, I think, at the end of this year.
Because I actually approached a naturopath about fasting. The cysts are not my problem, but a friend of mine has cysts,
Yes.
and a member of my family, and he was reluctant to supervise.
Well, generally speaking, naturopaths don't know much about fasting. They might know something about fasting for a day or two, but they're not really educated in fasting. In fact, most of the naturopaths I know are very much afraid of it. Oh, don't fast, whatever you do, don't fast, which is the conventional viewpoint. I mean, the conventional person will say, you know, if you want to fast, you think you're doing the right thing, you know, you think you go without food, you know, and that's a typical attitude. But of course, they don't see it in the proper biological context.
Well, for this person, I really want to avoid surgery, you see.
Mm-hmm. Well, I mean, I think that fasting would be probably the resort of choice. But certainly I'd want to check hormones and things like that first of all, because that's possibly where it's established. Okay. Yes, this way. Allergies? Well, it depends, you see. Allergies are a number of different types. I mean, whether we like it or not, all of us are to some degree sensitive to foreign materials. That's why we have an immune system. It deals with foreign agents. And let's face it, in modern society there are a lot of foreign agents around, and I don't mean aliens. But there are a lot of materials around to which we might be sensitive. But where a person has a typical allergy and they start sneezing at the sight of pollen, or if a cat walks in the room, they go into a paroxysm of sneezing or whatever, then we have definitely an oversensitivity. In that particular situation, a hygienic lifestyle is going to help a great deal. But at the same time, I mean, an experience that I always have, usually around about June, July, I take a trip to the United States. Now, I leave Sydney in the middle of the day, arrive in Los Angeles in the middle of the night, 14-hour flight. It's the middle of summer, it's the middle of winter here, it's the middle of summer there. And Los Angeles is much more polluted than Sydney, although Sydney's bad enough. Now, 24 hours in Los Angeles, my eyes are irritated, my throat is scratchy and sore, I start sneezing, and my nose will start to drain. Now, I believe that that's just a normal, healthy response to a very unhealthy environment. And that's not something I'm going to diagnose as an allergy. Now, if you're living in a particularly bad area, a lot of, automobile exhaust fumes around. I mean, I had a patient from Canterbury not very long ago who lived on a main road corner where lorries came up and accelerated out of the traffic signals, belching out all of this exhaust. And this person got respiratory problems and asthma. And the only way we dealt with that was to get them away from that particular environment. But certainly, a hygienic lifestyle is not going to get rid of ordinary, natural, normal sensitivity. If you're in a bad environment, get out of it if you can. But if it's a true allergy where there is this gross overreaction of the body to chemicals in the fronts, then certainly you would require more skilled and a more serious application of hygiene to get rid of that problem. Mr. Yes.
I've read somewhere in hygiene that it's a good idea to skip 4.5 to 5 hours between meals. What I used to do before, I used to have a lot of small meals, and when I started to put this into practice, and I've also learned that doing that after that time, your stomach sterilizes itself. But when I started to put this in practice, I put on, in 5 months' time, I put on 4 kilos.
My goodness.
So I wanted to know what your view on that idea.
Well, the possibility is that while you're eating very small meals, of course, you keep your appetite at bay. And then you go and wait a long while between meals. You get such a voracious appetite, you overeat. I mean, I know how that often will affect me. If I've gone a long time without eating, like quite I might have a busy day and not get through breakfast and not bother with any lunch, gets to the evening and I've got a voracious appetite. And the tendency is for me to overeat at that meal. I try very hard not to, but the tendency is there. And I think that instead of having a lot of small meals, you'd have probably been better if you switched to having just 3 small meals. You know, lady again, you had a little question.
I'm sorry, you talked earlier about not taking pills and things like that. Now,
Not taking pills, yes.
and then you can do more harm. So, with someone who has a serious allergy and they're told to take this or that in order to take it away, is that actually doing more damage?
Well, it's not removing the cause, is it?
But if it's a genuine allergy, how do you remove it?
Yes, a genuine allergy. Okay, right. Well, a genuine allergy is a pathological state, and that does require, a proper application of hygiene in the clinical sense. You're not just going to get a result by, or very unlikely to get a result just by making a few petty reforms in your diet and lifestyle. You're probably going to have to think about fasting and detoxifying and reducing this sensitivity that is evolved once again in the immune system. As I mentioned, fasting potentiates the immune system, and it's the immune system that's very much oversensitive in allergy. Now, why is it so? It can be any number of reasons for that. It might have been there for a long time, like people with asthma. You find very, very rarely does anybody, well, I've never even come across a case of a person who had asthma from birth. Usually develops in either the first few weeks or months or first few years of life. Very, very rarely do you find it in the first few weeks of life. It's usually after several months. So and that's a major, you get allergic asthma, it's a major problem. And also it depends on many different conditions too. Some people will only get it under certain conditions, certain environments, certain times of the year, certain temperatures and certain directions of wind and all sorts of things like that. But if you've got a full-blown pathological allergy, that's a very complex thing and requires individual investigation.
Yes. I was over in Los Angeles and San Diego, and I developed asthma, which I had as a child.
Yes.
And one of the ways I weaned myself off the drugs was to use a herbal remedy, which I found was available over there. After a bit of looking around, rather than what the people in Australia was recommending. Do you see a place for those sort of remedies?
Not really. You've got to realise that until the 20th century, medicine was a herbal practice. In the last century, all medical practice basically was herbalism. And herbalism is just a variation on medicine. And some of the most poisonous substances known to human beings are of herbal origin. I mean, strychnine and opium and belladonna and things like that. So I think all you're doing really is exchanging one medication for another medication. Now, I will be inclined to agree that in many instances, the herbal medication is probably not as bad as the regular medication that you get from the pharmacist. But you're still doing exactly the same thing. That would be my view anyway. I'm not really interested in any form of medicine at all. Medicine, to me, represents willfully ignoring the causes of the problem and at the same time trying to treat the symptoms. And whilst one can make a case and justify doing that in very rare instances, as a total program of plan of care, it's not tenable.
I was just going to ask, what about in cases of congenital diseases, people born with diabetes or hypothyroidism or thalassemia, where they've got two conditions?
Then you're going to have to use invasive care. You can't get away from that. I mean, one of the things, it's not a limitation on hygiene, it's a limitation on the body. One needs a body with which to work, and one that must work in that capacity. If you have a body that's born severely physiologically crippled, then you're going to have to use invasive processes to try and do something about it. There's no way you're going to get around that. You can't, by lifestyle, correct a situation which is some congenital problems you might be able to help a great deal, but if it's a genetic problem, you can't do anything about it. So therefore, you've got to use intelligent management. And I must say that's where medicine really comes into its own, in that area. Yes, the lady there. Yes. You're going to have to speak in a megaphone. Sorry? I can't hear you.
He wants to know if you can fast during diabetes.
Oh! Fasting in diabetes. And this should be very, very carefully monitored, only under the best of conditions. Because as you appreciate, with fasting, we were looking for that lowering of blood sugar level to a physiological minimum so the adaptations can take place. That's very, very important to the fasting process. In diabetes, you can get a malignantly high blood sugar level, which will not go down at all, no matter how long you fast. In such a case, you just cannot get any benefit by fasting in diabetes. On the other hand, there are many different types of diabetes, as we know. But in type 2 diabetes, age-onset diabetes, obesity, things like that, usually the blood sugar level will respond to the fasting process, whereby the fasting can be extremely useful. So it does depend on certain criteria there. This lady here. Pardon? Bloating. Yeah. Yes?
Now, would that be a natural way of reaction of your body because of the wrong combination of food? Or is it a psychological food, a nervous kind of situation?
Well, often a lot of digestive problems that result in bloating in later life are for the very reason I mentioned in my talk about children being given solids too early. They get distension and bloating of the gastrointestinal tract and forms pockets, and then when you get older, you're not too bad while you're eating sort of white bread as toast and cottage cheese or something, but you start to eat lettuce and cucumber, celery and lots of fruits, you get this gas in here, which is due to malfunction. And often it takes a while to recover. But of course it can be due to other factors, including anxiety. I mean, a person can get a lot of gastrointestinal problems, gastric and intestinal problems from anxiety and psychological factors. Something I probably should have mentioned in my talk and didn't, but a lot of many health problems have very, very major psychological or psycho-emotional components. They're maybe not psychological in themselves, they may not be emotional in themselves, but they have very strong psycho-emotional overtones. So these factors are important, and usually in a proper assessment this will be taken into account.
So you suggest that they find the cause and then treat the cause?
Yes, but it may be due to just incompatibility of the food you're eating. It can be as simple as that. I mean, I can give myself gas straight away if I go out tomorrow and eat certain foods, because I know from experience they're a problem, so I stay away from them. And most of us will experience that. You see, once again we get back to this point about the individual. We all have our own strengths and weaknesses, and we have to learn about that. I mean, I can give you a list of foods that will commonly cause problems with people, but I know many people who eat them quite happily, but I also know a lot who don't. So, you know, it's a question of trying to learn these things about yourself, what you handle, what you don't handle, and what combinations you can get away with quite comfortably. There's somebody over here a minute ago. No? Oh, this lady, right.
You almost answered my question. If the body heals itself when it fasts, what happens to people who have to take drugs for the rest of their life? For one reason or another, like blood pressure or whatever. How do you wind
Well, this concept of blood pressure, you mentioned blood pressure because you've got to give me examples here. What about people who take drugs, they've got to take them for the rest of their lives? Well, generally, we're not going to fast people while they're taking drugs. It's incompatible altogether. In fact, drugs represent complete incompatibility with hygiene altogether, really. But as my wife, Dr. Burton here often points out, it's never wrong to do the right thing. So even if you're taking drugs, it's still good to look after your health in other respects. But nevertheless, drugs are incompatible with health, from my point of view. Now, you mentioned here a person who, say, got malignant hypertension, extremely high blood pressure. Well, from my point of view, blood pressure does not elevate without causes. And I believe that blood pressure is one of the easiest things to deal with. And certainly one that, as yet, I haven't come across a patient with high blood pressure that we haven't managed to get down within a normal range through fasting and a hygienic program, in which case we get them off the drug. But certainly, if you have blood pressure, you go to the doctor, he says, oh, measure your blood, you've got high blood pressure, take this pill. Once again, what has that pill got to do with the cause of your blood pressure? Has he said anything useful to you about getting your blood pressure down? I mean, my approach is, first of all, why have you got high blood pressure? That should be your question to the doctor. Why is my blood pressure high? Can we find out why? And if I'm doing something I shouldn't be doing, I'll stop doing it. Or if I'm not doing something I should be doing, I'll start doing it. That's what we should be doing. But people, they go to the doctor, they're just like lambs to the slaughter. Anything he says, he writes a script, gives it to you, take this pill. Half the time he hasn't conducted any reasonable investigation. He might have sent you for an x-ray, he might have done a blood test, but he really hasn't done a proper analysis. And even when he does the blood test, even when he sends you for the x-ray, he usually doesn't give you any really useful advice. He'll say, take this pill, or you need surgery, or something like that. So my point here, I mean, every week in my clinic, my wife and I, we would see patients who are on medication for the rest of their lives. That's what they've been told. And in 99 cases out of 100, they get off it. They're only on it till the day they get under intelligent care. That's generally.
You say, Alec, is there such a thing as problem with low blood pressure?
Yes, it's a strange phenomenon, low blood pressure. Yes, there are very rarely occasions where people will have an unhealthily low blood pressure. They feel very weak and listless. They'll often faint at the drop of a hat and things like that. And usually this is an indication of some serious problem which involves, of course, the autonomic nervous system. They're not regulating their blood pressure properly. And sometimes it's a loss of reflex. But once again, I would not be using drugs to try and get the to get the blood pressure up.
It must be fairly rare.
Oh, it's very rare. In fact, there was an article in the Encyclopedia Britannica many years ago about hypotension, they call it, low blood pressure, and they said that people with this condition often live longer than the average population. So, a bit of a contradiction there. But I think what they were doing was they were diagnosing people with relatively normal blood pressure as having low blood pressure. For instance, when I go for a medical check for a pilot's, to renew a pilot's license, I always get told I've got low blood pressure. And the physician usually takes it 2 or 3 times. And he said, have you any idea what your blood pressure is? I said, yes, about 90/60. He said, how long has it been like that? I said, most of my life, as far as I know, and I intend to keep it like that if I can. And of course, as so many people, as they get older especially, the blood pressure goes up. Now, in my opinion, once you reach maturity, blood pressure shouldn't go up. If anything, when you're getting older, it should go down, as it does among many primitive peoples, but not in people in Western society. The norm is, or the average is, that it will elevate as you get older. And of course, the physician is trained to recognize that. So if somebody walks in, at 95, and they say, gee, you've got a blood pressure of 95, it's systolic is your age, all right, but, it should be 100 plus your age.
Too healthy for that.
Yes, George.
Vaccination is back in business now.
Oh, of course it is.
The government
It never disappears for very long.
The government wants to vaccinate everyone.
Actually, there's a new book out on the press, only 2 weeks. I got 20 copies the other day. Greg Beattie in Brisbane has published a book on vaccination. He had problems with his children going to school and so on, and he sued the authorities. And he went before a tribunal, and although he didn't win, the judge said he had an encyclopedic knowledge of the literature, because he took his own case and questioned all the experts. And there is the last appendix in the book, which runs through quite a transcript of the hearing and what the experts said and the lies they told. But that's not a bad little book. Greg Beattie, Vaccination. Yes, the lady at the back there.
What do you think of colonic irrigation and liposuction?
What do I think of colonic irrigations? Well, I worked in an institution once where we had a colonic laundry in the cellar, and we used to send them down there every day for an irrigation. And then we, of course, used to carry them back to their bed afterwards. They were so weak and tired. The bowel, like the mouth and other orifices of the body, is self-cleaning. That's why we have bowel washers. And I think we should remove the causes of constipation rather than resort to trying to wash the bowel out. Now, first of all, colonic irrigations are extremely debilitating. Depends how much water is used, but I know that I have come across clinics where they'll put 100 gallons of water through a person. Furthermore, the process of the irrigation can remove important substances from the gut that should not be removed. And finally, of course, they can result in considerable distension of the bowel because of the large quantity of water that is injected. So, generally speaking, except in extremely rare instances where there may be some blockage which is very, very difficult to move, I would never condone the use of colonic irrigation. I think it's extremely debilitating and thoroughly unhealthy. I mean, I might very occasionally, once or twice a year, be persuaded to use a small warm water enema, but that's about all. And even then it's only under protest. Don't like interfering with the bowel at all. All sorts of serious consequences in the long term can result. Yes, sir.
Alec, what would be your approach to eye pathologies such as cataracts and glaucoma?
Well, if the cataract has got to a stage where there's complete occlusion of the lens, I don't see any alternative but surgery. And it's usually very successful. If we have the beginnings of a cataract and we can just see them with the ophthalmoscope and they're starting to form, I think that fasting and good hygienic care may resolve it or bring about a significant improvement. But once they've reached a serious degree of maturity, I don't think there's much that's going to be done aside from surgery at the end. I think that glaucoma, well, we can have closed-angle glaucoma, open-angle glaucoma. Glaucoma usually comes about as a result of an obstruction in the duct of Schlemm, where the vitreous in the eye is drained, and therefore pressure will build up in the eye because it's not drained properly. Now, if a person is developing glaucoma, it's a medical emergency. The person can lose their sight in 48 hours unless something's done about it. So we have to think about emergency care to lower the pressure. And then I think afterwards, good hygienic care can reduce the, shall we say, the thickness of the fluid. The fluid is too viscid in the eye. If we can reduce the viscidity of the fluid and get it to flow better and the duct work more correctly, then we can get an improvement. And I've found that most cases will recover. Yes?
There's been a lot of discussion in the literature recently about the mercury film.
Yes?
And I'm wondering about the relationship of people who have had some mercury fillings actually removed, but prior to that, during there's been some diagnostic where it appears that mercury is affecting their well-being. What relationship fasting might have in that situation?
We're talking here about mercury fillings, amalgam fillings in the teeth. Now, oh, very good. I'm getting a real selection tonight. Very good. Right, now, on first principles alone, the hygienist would say that it is not a good idea to have mercury in your mouth. That's the first thing, that's the bottom line. Now, whether after many, many years it is desirable that the person goes along to the dentist and say, I want you to take all these amalgam fillings out. Now, whether that's a good idea or not, I'm not so sure. Because usually the mercury is sealed, and unless there's very, very good reason for interfering with it, I would be inclined to leave it alone. Now, in some people, you do get positive interference with health, and their health is adversely affected. There's no doubt about that with some people. And in those people, I would urge them to have the mercury fillings removed and, of course, adopt a good hygienic program, obviously. And I think the results that I've observed in those cases have been pretty satisfactory. But to just advise everybody to go along and have all mercury fillings removed, I think that's going a little bit over the top. But as I say, the basic premise is mercury in the mouth is not a good idea. But then again, there are a lot of hazards associated with removing it. We have to be very careful there. It has to be done under the most careful conditions. Now, if it's got to the stage where we have mercury in the tissues elevating, which we can demonstrate for the result of blood tests, hair analysis, and stuff like that, then we do have a big worry. because just removing the mercury fillings is not going to remove that. Maybe fasting will, and fasting does remove even those cumulative poisons like heavy metals will often be encouraged to eliminate with the use of fasting. But it's a real serious problem, and one that's been created in the 20th century with this sort of fancy dentistry. And one also has a worry about some of the resins that they're using nowadays too, whether they're going to cause trouble down the track. But certainly it's a big problem. Yes, sir.
Water being the healer, what type
What?
of water?
Don't dare mention that.
What type
Waters
of
are necessary.
Yes, but what I mean is what type of water?
What type of water? Clean water, pure water, distilled water. Water as best and as clean as you can get it. Anything other than dirty water, I think. And I include mineral waters as being dirty water.
That's what I mean.
Yes, I think that the nearer you can get to pure water, the better. But, I mean, once again, the mineral waters are given advertising which is not justified. And the fact that water contains all of these toxins does not make them healthy. So I would say drink as pure water as you can possibly get. Even if you're going to go to a place where the air is pure and you collect rainwater. That's pretty well distilled water. And that's very good. Yes,
So our population, I know you spoke briefly on vaccination, but does the population, will it survive if we're not vaccinated either by orthodox methods or by homeopathic?
the majority of people are not vaccinated. If you look at the people throughout the world, the majority of people are not vaccinated. Only a very small percentage ever get any immunisation or vaccination. The majority of people in Australia are not immunised. Okay, children might be immunised against certain things, but when you're talking immunisation, you're talking a whole range of immune products. And once again, I mean, is it a deficiency of the body that it doesn't have the ability to deal with these diseases should they arise? I mean, if you really look at the statistics, it's not a very persuasive argument that they present. First, they have great difficulty in trying to show that it offers any prevention at all. You look at poliomyelitis. They are always making the claim, and I hear it repeated on the television and radio and in the press almost every month, that we've got rid of polio by immunisation. Where's the evidence? Polio was epidemic after the First World War in the 1920s. It was then called infantile paralysis. It occurred after the Second World War, and the major epidemic being in 1947, with 50 cases per 100,000. By 1950, it had dropped to 15 cases per 100,000. By 1955, it had dropped to 8 cases per 100,000. That's why they introduced the vaccine in 1955. You can show by graphic it was already disappearing when they introduced the vaccine. That's like the man who was travelling to Sydney from Newcastle on the train, and he had a copy of the Sydney Morning Herald in his hand, and he kept ripping off little strips, rolling them into a ball and tossing them out of the window. After a while, the other passengers in the carriage on the train got curious about this, and they said to him, "Why do you keep ripping the paper up like that, rolling them into a ball and tossing them out the window?" He said, "It keeps the elephants away." So they said, "But there aren't any elephants." He said, "I know, it's effective, isn't it?" I mean, if you immunise against something that doesn't exist, it's very effective. Now you look at the graphs of measles, whooping cough, all of these things you'll find when you look at the graph of the 20th century, the whole thing was going on a massive decline. And right at the bottom of the graph, that's when they introduced the vaccines. So it's not very impressive to show us, first of all, that it has any ability to prevent the disease. And we also have people who have had the immunisation and still get the disease. But what's their explanation then? They get onto the back foot and they say, "Ah, yes, but they didn't have it as badly." Now, how can you ever know that? So, and the other thing is, First, it doesn't prevent it. What about side effects? I mean, you can get from poliomyelitis vaccine, from measles vaccine, especially from whooping cough vaccine, the most disastrous side effects. The person's almost brain dead as a result of it. Encephalitis. Okay, I agree. These consequences are rare, but it's still a risk. And what do the government do when they introduce these programs? They pass a law that prohibits you from suing anybody if such a thing occurs.
Well, then they can't make the new law that they're proposing of children not being allowed in school unless they are immunised.
No, they can't. That's what they're trying to do, but what will happen, you see, there'll be an escape clause. There'll be a clause where if you've got a conscientious objection or a religious objection or whatever, you'll be able to get out of it. They will always give people that.
They don't advertise that.
Oh, they won't tell you about it, but it'll be there for sure. Because, you know, they just have to do that, because if it went to court... And also, you've got a wide range of people suffering from hypogammaglobulinemia, agammaglobulinemia, and problems with the immune system, that to immunise them is very dangerous. They will get 100% side effects. So they have to allow those people to get outside. Anyway, the whole of this demands a talk on its own, really, because there's a lot of statistics. You have to have audio-visual with graphs and show numbers and figures, and it's very easy to do that. It requires a talk on its own, really. I don't want to get bogged down in that too much now. Right, ladies and gentlemen, well, it's 10 o'clock, and I thank you very much for your attention. It's been a pleasure to be here. I hope you've learned something, and if you haven't, maybe you can teach me a little bit. Thank you.
I'm just going to draw the raffle now, and would you like to take your elbow? Yeah, I do. We'll start off with the third prize. Was donated by Coburg Health Foods shop, and it's a water filter jug. So, you want to choose one? Okay, H1. The first person who came this evening. Oh, wow. Okay. There we go.
Very good indeed. Thank you.
And thank you for that donation. The second prize is a $1 fruit basket from the Fruit Shed in Carlton, which is that one. And
Just get one from the bottom.
okay, page 2.
H56. H56. 5-6.
Oh well,
This is what.
the great prize.
There's something wrong there. She'll run back so much. Congratulations.
Third one is a gift voucher, a rug gift voucher. You'll have to see me for that one.
64.
H